If memory loss is something that comes about last towards the advanced stages, is it a commentary on how underdiagnosed dementia is in India?
Yeah, so a memory loss can occur as the initial signs of Alzheimer's disease. Even during the earliest part of my training, I was always surprised at how little emphasis geriatric care is given in clinical psychology training.
So we'd love to know more about this interesting journey. And I think this is the first time I've heard somebody talk about their organization as a social experiment. Hello, everyone, and welcome to the 8th episode of our podcast, Native Narratives. Every year, September is observed as World Alzheimer's Month, and the 21st of September is celebrated as World Alzheimer's Day. Our guest for this episode is a clinical psychologist who has made a huge impact on India's approach to geriatric mental health care and how we view Alzheimer's and dementia. She's a Global Atlantic Fellow at the Global Brain Health Institute and the co-founder of Samvedna Care. Please welcome Dr. Jayashree Dasgupta.
Thanks a lot.
So, tell us how you got into this and how Samvedna came about. We'd love to know more. We know that Samvedna is a community-based organization that focuses on integrating the community into rehabilitation plans for dementia and Alzheimer's care. So please tell us more.
Absolutely. Thanks a lot, Tanvi, for also focusing on this area because it's hugely important, and we don't actually give it the importance it's due. That was one of the reasons why I actually got into Samvedna. I was initially working as a clinical psychologist, and my focus was across the lifespan, more so with looking at neurodevelopmental disorders in community settings. And I was always, even during the earliest part of my training, I was always surprised at how little emphasis geriatric care is given in clinical psychology training, when it's obviously inevitable that with increasing longevity, we're going to have challenges that the elderly population is facing, one of which is obviously dementia. I joined Archana, who's the founder of Samvedna. Initially, I was volunteering, to just help her when we were running a day center at Samvedna. And then we together built out the dementia services. And that's we like to call ourselves a social experiment, actually, because we've tried all sorts of things in various formats and tried to see what people understand, what people need, taking feedback from them, and all the time using a lens of evidence-based practice. So we've had a kind of interesting journey along the way.
So we'd love to know more about this interesting journey. And I think this is the first time I've heard somebody talk about their organization as a social experiment. So more on that soon. But I want to start off by discussing what dementia is and what Alzheimer's is. Most often it's used interchangeably, where you say somebody has Alzheimer's and the symptoms usually presented are just dementia, or you say dementia, and it's assumed to be Alzheimer's. So, if you could please elaborate on what each of these terms mean and how, if they're different from each other, that'd be great.
Absolutely. And I think so. You're right. Often people think that Alzheimer's is dementia, but Alzheimer's is actually one type of dementia. Dementia is an umbrella term, and it's basically a group of symptoms where cognition, that's everything that's around what we use to think and function in our day-to-day lives, gets impacted. So that includes an impact on your memory, attention, thinking capabilities, organization, planning, even aspects of your language, ability to understand speech, express yourself. So all of these things get impacted. Alzheimer's is the most common form of dementia. It's one type of dementia, and that impacts anywhere between around 60 to 75% of people who develop dementia. So that's the reason why there's this myth that Alzheimer's is the only form of dementia and that memory loss is the only symptom of dementia. But there are various other forms as well. Just to name a few, there's Lewy body dementia, frontotemporal dementia, vascular dementia, and these are less common, but again, different forms of dementia.
That's interesting. So I think from a very general point of view, dementia and Alzheimer's both are associated with memory loss. But you mentioned a couple of new terms that I don't think most people are aware of. So, is memory loss the most observable symptom of dementia? And is that why it's so often used as, an identifier? Is this memory loss something that happens early on during dementia, later on? Why is it the most prominent symptom, basically?
I think memory loss is the most common symptom of, it's like a hallmark symptom of Alzheimer's disease. And that's why people often think of dementia as meaning memory loss, but it's not the only symptom. And for example, in frontotemporal dementia, which is a rarer, it's less common, the change is actually in personality. That's the first, predominant sign that you see. People, because it impacts the frontal lobe and the temporal regions, which are which play a significant role in how social understanding and cognition processes work and how your personality is. So people notice that someone is just changing in the way they're behaving, and then memory symptoms can occur later on. Memory loss can occur later on, but it doesn't necessarily have to be the first symptom. And in fact, that's something in even in Alzheimer's disease. By the time that memory loss is observable, it's a significant challenge for the individuals. And that's something which often family members or friends, close, near and dear ones, are able to pick up. But there could be initial signs such as confusion, getting lost in familiar places. That's a sign. We've had a couple of cases where that's been the factor that have made family members sit up and say, "Oh, there's something wrong. This is not just natural aging."
So, if memory loss is something that comes about last towards the advanced stages, is it a commentary on how underdiagnosed dementia is in India? And is advanced stage the largest population of people or patients that you see?
Yeah, so a memory loss can occur as the initial signs of Alzheimer's disease as well. It can occur at any stage. The presentation can be very different for each individual. Sometimes the reason why I just want to mention that is sometimes we've seen a lot of people who have Alzheimer's disease with memory loss. They're essentially people who've been functioning very well throughout their lives, and they're able to do what we call as masking. So they're able to hide their symptoms until it reaches a point where they're no longer able to hide it. And just to mention, there's a 90% treatment gap for dementia in India. That's what the statistics say. So that means that only 10% of cases actually get a diagnosis or any sort of professional help and support. One of the reasons for this is because it's sometimes very hard to distinguish between what is normal aging and when a disease process is setting in.
So that brings me to my next question. What is the difference between normal aging? I mean, there is cognitive decline towards the later stages of life, but how is it different from the cognitive decline in dementia?
Yeah, that's a really great question. And I think that this is something that people really need to understand, because it's just so important to watch out for these signs and symptoms amongst older members of your family or friends, and also as adults ourselves, as we're aging, it's important to keep a tab on this for ourselves. If we're experiencing any of these things, which I'll just discuss now, it's really important to just take note of it. So we're talking about memory and changes, challenges with memory and memory loss. Now, I'm sure everyone has forgotten their keys somewhere or misplaced their glasses. That's not a sign of dementia if you find them later. That's fairly common. If you keep doing this, some people do this very regularly, right? They just describe themselves as being fairly careless or whatever. In dementia, a person loses things and then, just isn't really very bothered about it. They don't remember that they've lost these things. They don't remember where they've kept them, so they don't remember that they've lost it either. So it's that sense of it not really making a difference to them that's often the something that family members begin to pick up on. I'm sure a lot of us have traveled somewhere new, got lost with directions, trying to find a place. That's again normal. If in dementia a person begins, can get lost in familiar places. So we see that, we have people who would be going every day to buy groceries or the medicines from somewhere close by. And then they get lost. They just get confused about what is the way back home. It's a familiar place and they're getting lost there. Forgetting names. You know, you meet somebody at a party or something and you're struggling to remember their name, or you call them by someone, another name. That's again fairly common. But in dementia, people forget the names of those who are close to them. So people whose names they should be remembering. If you don't meet somebody for a long time and you don't remember their name, that's absolutely fine. And sometimes people just assume that these are things that happen in natural aging. The difference is that in normal aging, cognitive processes tend to slow down. So you might take longer to remember these things. You might take longer to remember where you kept the keys, where you kept your glasses, return back from the grocery store or whatever. But you won't have these kind of challenges, which are a result of underlying disease process like dementia.
This is a very useful tip for most of us, especially I think youngsters who around the age of 40, 50. That's a subjective way of approaching youngsters, but then compared to the early onset age of dementia and Alzheimer's, I feel like the 40, early 50s is still a younger population, right? But most often, when you say early onset Alzheimer's or early onset dementia, the word early automatically sort of takes you to the younger population, which is like 30s, 40s, not even 50s, right? So how can we term it as early onset if it's not really early on in life? And why do we do that?
Yeah, so one of the biggest risk factors for dementia is increasing age. So the older you are, the higher risk of developing dementia. Early onset dementia is typically when it occurs before the age of 60, 65. That's what we call as early onset. We've seen cases of dementia onset in 40s as well. So that's a distinction. The other thing that is really important to remember is that you can't, and I see this term kind of emerging. There's this term called digital dementia. I just thought I'd throw this in there because that's something that I'm hearing a lot more younger adults talk about, people in their 20s, 30s, 40s, and it's basically that has nothing to do with dementia. It is basically just it's not a clinical condition. It's just the kind of cognitive challenges that people are facing due to increased, and prolonged digital technology use. So I think that's one term that I'm hearing a lot more frequently now, and I just think it's important to draw that distinction that has nothing to do with the dementia that we're talking about today.
So when younger populations, and by young I mean anyone below the age of 40, late 30s also, when they start observing such symptoms, say of memory loss, confusion, disorientation and stuff, I've heard the term mild cognitive impairment being used a lot more
Mhm.
than say pseudo dementia or dementia. Could you shed some light on that?
Yeah, mild cognitive impairment is again another a term that's taught when there is a uh, cognitive functioning which on testing is lower than the normative standard. And pseudodementia is when the underlying condition is basically depression, but it manifests with symptoms of uh, dementia. So it's actually quite confusing because it's not a very straightforward process of diagnosis as well. There are several factors that could contribute to somebody forgetting things. Um, and we're talking about like younger adults, maybe in their 30s or 40s. Sometimes when you just have a lot of things on your plate, you can become forgetful when you're multitasking, and as many younger adults at this life stage do, it can become overwhelming or confusing and challenging, and that is not to be confused with the kind of cognitive change that we are seeing in dementia. So I think it's just really important to remember that standardized testing or neuropsychological assessments, if anyone is feeling that they're, the kind of challenges they're experiencing with their memory or their attention is different from their peers, that it's always important to go and seek professional help and have a neuropsychological assessment so that you can actually objectively see whether this is something to be concerned about, or it could just be some other factors that are influencing the cognitive processes.
That's very interesting. So I want to know, I want to ask you something about Samvedna now, and the social experiment of sorts. So have you had people in mid 30s or early 40s come in with something like this at Samvedna?
I'd have to say it's fairly rare. We've seen I mean, very few cases with that early onset. What we do see, though, is in that age group is adults with Down syndrome. So adults with Down syndrome develop dementia. The lifespan is shorter, and you do see dementia in the 30s and 40s in Down syndrome. So in India, it's again something that's not really well known or looked at. I did my fellowship in Ireland, where this is a huge body of work going on there, and we've seen a couple of cases where people have approached us, largely to understand what they could do, who've had Down syndrome and then developed dementia. But it's almost like the approach is to, because dementia occurs in Down syndrome earlier on. It's almost like a model to understand what is happening in dementia, and understand what you can do for interventions, and study the disease through a different model as well.
That actually brings me to my next question. It's very interesting that dementia in Down syndrome starts early on because the lifespan is short, right? So, is this a trend in, say, existing diseases that when the life expectancy is short itself, does the early onset of dementia begin really early on?
It's not because of the reduced. I mean, we know the life expectancy is shorter, and in Down syndrome, there's other processes that lead to the dementia-like symptom. It's not just because of the reduced lifespan, but definitely what you're asking in terms of lifestyle factors. There's actually a huge body of emerging work now that's looking at modifiable risk factors in dementia, and there's 40. They've actually, researchers identified 14 modifiable risk factors that can account for up to, a risk reduction of 45% towards your risk of developing dementia. And that's huge. So in, dementia, obviously there is a genetic component, there is, this environmental component, but to say that there's, we can't control our genes. But if you can control some of these modifiable risk factors, then you could reduce your risk of dementia up to 45% is huge. And these risk factors include things like education in early life, and through the midlife, things like hearing loss that accounts for 7% increased risk, which is fairly large. High LDL cholesterol, right? Again, something that's hugely common: obesity, smoking, head injuries, uh, things like visual loss or impairments, and depression, social isolation. So, there are several factors, and some of these things are things that we can do a lot to control. So that's something which is really important to remember. And there is a push now to look at more, looking at prevention, because we don't have a cure for dementia yet, unfortunately. So there is a huge push towards seeing what we can do to prevent dementia, keeping these modifiable risk factors in mind.
So, could you give us a few more examples of these risk factors and how we could avoid them or navigate them? So, cholesterol and vision, all of those things are something that happens in normal life, right? A lot of us sort of have vision problems early on in our childhood, to be honest, and sometimes there's nothing we can do about like vision loss, but cholesterol and those kind of factors, I think you can control it with your lifestyle choices. So what are other preventative measures we can take to sort of protect or enhance or hone our cognitive skills to a level where the risk of dementia is reduced?
Right, absolutely. And that's a really great question, because I think so. So the way that researchers have looked at this is they've tried to really understand across the lifespan what are the different factors, risk factors that are there, which are potentially modifiable. Um, Education is one of these factors. We know that education in early is one of these early life factors. So anyways, there's a huge push towards saying you should have education, quality education, and that one of the reasons for that is it provides the brain the stimulation it needs. Ultimately, it's an adage that you if you use it or lose it. So if you're not stimulating your brain, that itself is not doing you any good. So education just helps individuals stimulate different parts of their brain, and then it kind of leads to a lifestyle where you're likely to be uh, doing things that will lead to your brain being stimulated throughout the life course. You were talking about hearing loss, and hearing loss is also quite common, it's quite prevalent, but hearing loss occurs much earlier than most people realize or recognize. And there's a lot of stigma around the use of hearing aids, for example. But the brain receives its stimulation through the auditory and the visual modes. We're very happy to wear glasses, like you were saying, but there is a stigma about wearing a hearing aid. So I think it's really important to think about getting your hearing checked if you're in your 40s or 50s and people around you are saying, why are you talking so loudly? Or, you're turning the TV up too much. And I think there's, probably we still don't know this, but I definitely feel, with the amount of times that we're on our phones and everything, this is also going to impact hearing loss going forward. So regular checks for that. We need to work on addressing the stigma and then providing, using simple things like hearing aids where it's needed so that it doesn't lead to that sensory input loss into the brain. Hypertension, diabetes, all sorts of lifestyle modification, exercising to keep obesity, in check. These are things that will reduce the risk of developing dementia. So, exercise as per WHO guidelines, it's like every day, I think 20 to 30 minutes, moderate, exercise, really important to incorporate into your day-to-day life. And then there are things that we have lesser control over in our day-to-day lives, but are important to think about more at a societal level. So head injuries are a risk factor for dementia. So driving with a helmet, if you're on a bike, very critical, following traffic rules and safety measures and all. These are like critical things for reducing head injuries. And air pollution is also one of these factors. So I think we just need to think about how we can, even at a more systemic and large societal level, reduce these things, which also have an impact on increasing our risk for dementia.
That's very interesting, especially the stigma around hearing aids is something I don't think most people notice. But it's very true. I see very few people with hearing aids compared to glasses, right? So it's very interesting. Is there any other disease or disorder which has a higher comorbidity with dementia? Something that we could detect early on in the life, say a neurodevelopmental disorder, like you mentioned Down syndrome. Is there something else that begins on shows symptoms early on in life, but then could be sort of a risk factor for dementia later in life?
So I think diabetes and hypertension, these are so prevalent. And there's been research studies to show that people, I think of course it varies. I don't remember the exact statistic, but somewhere up to, I think, 81%, in a comparison that people with hypertension, 81% of the sample had like hypertension, who also had dementia versus those who didn't. I mean, that's huge. And again, I don't remember the exact statistics, but it's fairly alarming to see that this contributes so much when these are such prevalent conditions. And that's why one of the things, so diabetes and hypertension are the modifiable risk factors which contribute towards an increased risk for dementia. And there's so much you can do about it. So if you're diagnosed with these conditions, there are things that you can do, for example, to keep your sugar in check. Controlled diabetes will obviously reduce the risk for developing dementia, but uncontrolled diabetes will increase the risk more.
it reminds me of this one factoid I had read, and which was debated extensively in a clinical neuropsychology class for us, which was the prevalence of dementia and Alzheimer's and gender differences in dementia and Alzheimer's. So I think even in television and in media portrayal of Alzheimer's, it's always the woman who somehow has dementia or Alzheimer's. And even I think a few of the older statistics available to us says that the incidence rate of dementia and Alzheimer's is a lot higher in women compared to men. But then, if we look at the disease you mentioned, like diabetes or hypertension, I think the stats over there do not concur with the stats for Alzheimer's, right? Like most older aged people have hypertension and diabetes, and the gender difference isn't too drastic in that. But why is there such a imbalance when it comes to Alzheimer's or dementia?
Yeah, that's a really great question. And you're absolutely right. The incidence is higher in women. And one of the reasons for this is that women tend to live longer than men. And the largest risk factor for dementia is increasing age. So, with increasing longevity, we're going to see more and more people of both genders developing dementia. Currently, that's the reason why we have more women who have dementia, because they're living longer and therefore a greater risk as well. The other thing in women which contributes to this is there's emerging research to show that the protective factors of the hormonal changes that women undergo would have had they have a protective impact on cognition, and then with menopause and changes in later life that can also impact cognition. And I don't. It's still not one of those risk factors on that list that there isn't evidence to support. But there's a lot of research ongoing to see whether how much this is actually impacting women. But definitely there is evidence to show that the protective effects of these hormones on estrogen and all in women then kind of like plateaus off in later life.
So, since you mentioned hormones, is there um, research or evidence that suggests that fluctuations in hormones could also be a risk factor or an indicator of early, like an early detector for dementia or risks of dementia? Because um, the trend these days is that women are reaching perimenopause or just menopause way earlier than they did before. So is that also bringing down the onset age for dementia? Is there a correlation between the two?
I'm not really sure. That's a really interesting question. It kind of like it's something worth looking into. I don't know the research. I haven't looked at the research there, so I won't comment. Be able to kind of like comment with an informed manner about that. But it definitely sounds really interesting, and I think there's just a lot more need for longitudinal studies. There are several longitudinal studies that are looking at how at natural aging. Center for Brain Research in India is doing huge studies to look at the aging brain, and I think some of these things are going to become clearer as in the coming years. But yeah, I don't know for sure. It's something definitely worth looking into and seeing what we can do to address that if there is a correlation, which I'm not really aware of though.
Well, I love that there's more to research, and always excited to know that there's so much more to find out about these things, and there's no definitive answer to certain questions here. So that's very hopeful. Uh, Coming back to the social experiment, I'm very curious about why you called Samvedna a social experiment, and what kind of experiments are you conducting?
Yeah, now that sounds scary. But I think we call ourselves a social experiment because when initially Samvedna started as a daycare center for active aging, and there were classes where, like for language classes, like yoga, just it was basically a healthy aging center where older adults could come and socialize, learn something new, do all the things that we know are really good for your brain to encourage active aging. During that time, it was seen that there were also people coming into the day center who had clear cognitive impairment, but without a diagnosis. And again, that's not surprising given that there's such a huge treatment gap for dementia. And so what we decided was we looked into developing and adapting stimulation therapies for dementia and developing then services to support these adults with special needs. And prior to the pandemic, we were running groups for cognitive stimulation therapy for people with dementia. We even ran a dementia cafe for people who were at advanced stage. So it was a very free format kind of setting where people could come with their family to just interact, and we would have staff that would support them with whatever stimulation activities they were capable of doing at that level. Because at advanced stages, I mean, we had people coming in who didn't have any expressive like speech at all. So they were so the kind of activities that we could do with them were fairly limited, but it was just the socializing is so important. Just coming out, being in an environment where there are other people is so critical. So we did a lot of those things, and it was really interesting and very great. And then of course the pandemic hit, and we had to shut shop. But that forced us to really think about what we could do online, as the whole world was going online at that time. And prior to the pandemic, the other thing which we had also done at Samvedna was digital literacy programs in association with Help Age India. And we were actually educating people, older adults, on becoming digitally literate. How do you look at your bank? How do you book a cab? How do you order groceries? All of that. And then that experience came in handy when we were moving on online, and we started to see how could we support families and people living with dementia online. So we developed services to then support people online, including how to train family caregivers to take care of their loved ones with dementia, how to provide them, education about what they're actually seeing as these symptoms, and understand what they could do differently to, say, for example, reduce aggressive behavior, or to deal with something like wandering. So those were some. So we kind of like really innovated to see how we could go online, and that was another experiment. And then after the pandemic, we've subsequently not resumed the day care model, but we do have, people can come to the center for stimulation therapies. We have specialists who go to the homes for providing stimulation therapies, and we also provide the end of life care and support, which is once a person becomes and reaches the advanced stages of dementia, they often become they basically require a lot of personal care support. So we provide attendants and nurses who are trained in providing dementia sensitized care. So I think we call ourselves an experiment because we've tried various things. We've looked across the entire journey of dementia care and tried to see what kind of solutions can support people to care for their loved ones with dementia. Because, as you know, we don't have institutional care facilities in India. They're very few. So majority of care is actually provided by family members in the home.
It's very reassuring to know that there are organizations like yours that are going out of their way to figure out solutions to help people with dementia. It's a very personal approach, in my opinion, because if I was looking after a loved one with dementia, I would try every available method or intervention that is known and available easily on the internet to help my loved one out. And I feel like it sort of reflects in the work Samvedna is doing. And kudos to you guys for all the effort you've made and for helping a lot of these people understand Zoom and the internet when it's hard for even a few of us to navigate. So, really great job. And I wanted to ask you, when you talk about a bunch of questions actually with respect to what you just said. Samvedna seems to be doing a lot of interesting work, and I have a couple of questions that I'd like to go over. So, the first one is, when you say stimulation, What kind of stimulation are you talking about?
So we what we do is known as cognitive stimulation therapy, and this is we basically adapted a model that's been used widely in the UK. It's one of the it's a recognized non-pharmacological intervention for dementia, known as cognitive stimulation therapy, which was developed by Amy Spector. And we basically adapted this form of stimulation therapy to so that it's relevant for our communities and societies and people in India. What this what this intervention basically is, it targets the various cognitive functions that are impacted by dementia, using a somewhat so using like a semi-structured format. And the premise of this is neuroplasticity. So one of the things that we do is the cognitive stimulation basically says, we encourage the brain to we stimulate the brain and hope that neuroplasticity will set off, and that there'll be some way in which the brain will kind of reorganize to keep these functions going. So the sessions typically we ran group sessions prior to the pandemic, and we continue to do individual sessions. It's ideal for people with early onset dementia, but very few people come in at that stage because it's largely ignored. And we work on things like helping them to orient themselves to their surroundings. So, for example, in dementia, people may not they do not know the date or the day. That it's really important to be oriented. They won't recognize people whom they are familiar with. So we help them with various aspects of orientation. There are interesting game-like activities that are used to stimulate memory. There's various forms of tactile stimulation, so using touch as a modality. We also use very interesting forms of stimulation through arts-based approaches. So using things like coloring, creating something new. And all of this, the premise is all of these things are not, they stimulate the brain, but they're also really fun and engaging. And I think another underlying non-specific factor is the relationship that the person with dementia develops with a care specialist. And that's a new friendship. And I often tell people that, people with dementia, because of the condition, they don't go out and make new friends. And that itself is such a huge stimulatory process. So, we work on all these various aspects through the stimulation therapies.
So, speaking of the social aspect of stimulation, I like I mentioned before to our audience, Samvedna is a community-centered organization. So, what efforts do you make, or do you have any programs and strategies in place that works towards inculcating an unaffected population into a dementia inclusive society? So, is there any measures you take to talk to people about increasing awareness or include people who are unaffected by dementia in helping individuals with dementia? Like, what is the community that you're centered around?
That's a great question. And I think so. One of the things that we do as part of the Samvedna Care Foundation is public awareness and engagement, and we that's also where we do a lot of our research to understand what's working, what isn't, and how we need to adapt and modify the kind of services that we're providing. Um, We've done several public awareness programs over the years, and we've gone into, for example, resident welfare associations and done screening camps to where we do a cognitive assessment and dementia screening. We also do a mental health assessment as part of this, because I think it's important to understand mental health as well, and that's one of the ways in which we connect with the community. We regularly do talks and webinars to educate people about various aspects of elderly care. And we also have different programs that we host from time to time at our center. We also have a support group for caregivers of people with dementia. And then we do I mean, for example, this World Alzheimer's Day on 21st, we're hosting a film screening and a panel discussion uh, focusing on caregiving concerns in dementia. And that's a free event. Anybody can come in. It's being held at the Alliance Française in Delhi on the 21st of September from 5 p.m. onwards. And so we do these various things to engage with the community and really sensitize people about what are the signs of dementia. How do you differentiate this from natural aging? And what do you need to do if you're concerned about someone? So one of the things we actually have, and you can look at our website and see this, there is we have a self-assessment for dementia, because what we realized was that there's a lot of stigma about coming and meeting a clinical psychologist or a psychiatrist or a neurologist, and people are hesitant they don't really know what will happen in a session or what is an assessment. So we have a very simple self-assessment for dementia. You can take it for yourself, or do it for somebody else who you might be concerned about. And we have one for caregiver burden. And these assessments, once a person takes them online, they're free. You can just access it and do it. A person will be provided information based on the responses that they've shared, and this will kind of point them into a direction about the choices or the things that they might want to consider. And so that's these are the different ways in which we've been connecting with the community. We also work very actively with college students to sensitize them about early signs and symptoms, because they're really the torchbearers when you come to a dementia inclusive society.
It's very interesting. I would have never guessed college students as a population that you would work with, especially given that it's dementia, right? So, what kind of interactions do you have with college students? What are the programs you have in place?
So we do reach out to colleges, and if anyone's interested in, having us come across and doing like an awareness talk or a sensitization program with students, they can approach us, and we do that with students. We do a lot of workshops as well to help them understand what not only what are the early signs and symptoms of dementia are, but what is the actual experience that somebody may be having who has dementia. And it's quite interesting, because since we've been doing that, we've seen cases where it's the grandchildren who bring their grandparents in because they're concerned about them. Uh, and the children may actually say, no, there's nothing wrong. But there's also a very important dynamic to understand there, that it's difficult for us to see deterioration in our parents. So often we ignore very obvious signs, or we put it, there's such a lot of guilt associated with it when you see your parents are struggling or something, that you sometimes you struggle to accept that there may be something more going on. And we've actually seen grandchildren then saying, hey, let's just, I'm concerned about my grandparents. So can you do an evaluation, or is there something that I can do to help them?
It's very true. I think it's very hard for us to accept that our parents are getting old. So I
Absolutely.
completely understand. But um, since I'm sure you've had a lot of patients come in at an advanced stage, but you said you've rarely seen cases of people in the early onset coming to Samvedna, right? So, do you think it's because people are in denial of getting old? Like, it's clear that children have difficulty with accepting that their parents are getting old, but then humans in general have some sort of an issue with getting old. Do you think the denial is what is stopping people from coming in for screenings, for help?
Yeah, I mean, that's a really interesting way of putting it. I think there's definitely a stigma and a fear about going in for an assessment. And I think it really is about, dementia is a stigmatized condition. I mean, you've heard of the term satyage, which is literally the way that we look at, I mean, that colloquially describes older adults who are just beginning to lose it. And often that's somebody who's developed dementia and has then become, increasingly challenged in terms of their cognitive functioning. Uh, I don't know whether it's about a denial of aging. It could be a combination of just lack of awareness, fear about what if there is something actually wrong with me. And then we also see concerns about becoming a burden on families. So we actually have some data around this, and we've seen that particularly amongst women, qualitatively, they don't want to seek help because out of fear of becoming a burden on the family, and they will mask or hide the symptoms that they're experiencing early on. So a lot of times, the person with dementia, particularly, we've seen this. Most of the clients we've worked with are actually high functioning individuals. Some of them have been in very well-to-do jobs, and then dementia set in. It's very hard for these individuals to accept what's happening to them, and for often these symptoms have been there for 5 to 8 years before they've actually come to a specialist for a diagnosis, and that's usually at a tipping point where something has happened that's really made the family members sit up and say, no, there's something wrong, and we need to do something about it and seek help. But there's this prolonged period during the initial stages when there is a lot of denial and masking. And it's sometimes very difficult to also figure out when to seek help. And that's one of the reasons why we have the Samvedna map and these assessments, which are on our website, so that people are more informed to take a decision on their own.
It's a very interesting point about when to seek help. Um, and very simple question, when do you think we should seek help, and when do you think we should start thinking about our cognitive decline?
I think if you're thinking about cognitive decline, so let's look at it from this way. What do we know and what do we not know? We know that increasing age is a risk factor for dementia. Um, we know that we all want to live longer and we hope to live longer. We want to live healthier, happier lives for longer. And that's where we need to start thinking about preventing dementia from today. I think whether it's adults thinking about their children, encouraging, obesity, like alcohol, use of alcohol, smoking. These are things that people could do in, younger ages. These are risk factors. Right to, exercise, lifestyle modification. Those are things that we need to think about. So in terms of, we need to look at it as preventing or lowering the risks of developing dementia through leading a healthier life. And I think the things that whatever is good for your heart is good for your brain. So exercise, nutrition, sleep, all the good stuff is good for your brain too. So we need to follow that. In terms of when do you seek help? If you're experiencing feeling overwhelmed, if you're experiencing challenges with your memory, if people are telling you that you're forgetting things more often than previously, why not just go seek a professional opinion? The professional may say you have nothing to worry about. You're absolutely fine. Continue doing what you're doing. That's reassuring. But if you delay it, you could miss out on the early period of intervention and stimulation that could actually help delay the onset of symptoms further, or the worsening of symptoms.
I have one question about that. So, have you ever had people come in thinking that they have dementia, but turns out that they didn't?
We have, in fact, we've had people who, I've seen people who have parents who've had dementia, and they are concerned, very naturally so, about their own cognitive abilities, often whilst they're caring for their parent with dementia, when they begin to lose things, they're struggling. So yes, that we have seen people come in for those reasons. And again, it's sometimes, there's life is complicated, and sometimes it can be overwhelming. And when you're multitasking with too many things, or you're, not really taking care of your mental well-being, it can impact your cognitive functioning as well. So sometimes, we've done assessments to reassure people that It's actually just these other factors which they need to take care of. And in terms of cognitive processes, it's fine. So yes, and I think that's exactly what I mean. But if you're feeling concerned about something, go meet a professional who can advise you correctly. Don't sit there with that concern in your mind, because that's only going to impact your mental well-being.
Okay, so we've spoken about screening, we've spoken about the community building around dementia, but what happens once the diagnosis is made? Like, where do we go from that?
So once a diagnosis is made, I think the most important thing about receiving a diagnosis of dementia is that it enables family members to actually plan the intervention, plan their lives really. Unfortunately, there is no cure for dementia, which means that gradually over time the person will become completely dependent on others for all aspects of um, or daily living. So be it from feeding, bathing, toileting, taking care of themselves, financial, management, all of these things will get impacted. The person will no longer be able to live independently. And a diagnosis helps families to plan what they need to do to facilitate care throughout the dementia caring journey. Um, so people need to think about how they manage their financial resources to provide care. Is it something which they need to think about who's going to provide care? Are they going to do this within a family, home-based setting? Are they going to look for an institution where they would like to, um, put the older adult? What are the kind of understand the resources that they have to provide care? That's an important decision point. There's also, and we call it all of this advanced like care planning. It's really also about thinking of who's going to get involved in the care process. We see a lot of families. There's three siblings. All of them are living outside of India, and this is actually an area of my research. I'm looking at transnational caregiving, and the older parents have been living in India for several years independently, and then they develop dementia, and this impacts the entire family. So how are they going to manage that? Who's going to be taking decisions around when someone maybe a hospitalization is required? Where are those resources going to come from? How do they mobilize the immediate community? Who are the neighbors that might be involved? Who are the other close uh, family and friends who might be, whose help might be used to support the care? Would you need like an attendant to support care in the home? So it's really about understanding how to plan for the future.
So, have you ever had somebody who, after receiving a diagnosis, who's refused care, who's refused treatment? Um, like you mentioned, there's no sort of cure for dementia, but there is management involved, right? In, say, symptom management or pain management. Have you ever had somebody who said they don't want it, or who's refused to accept the diagnosis or treatment? And in those cases, I think another important thing that I want to know more about is whether these individuals who come in for screening have any sort of, autonomy over these decisions. If their cognitive capabilities are on the decline, are they in the position to decide whether they can refuse care, or is that decision made for them by their caregivers?
Yeah, I mean, we really see most cases in a moderate to advanced stage of dementia. And the so you asked about whether people have refused care. It's very common for the person who has dementia to deny their symptoms and say, we're absolutely fine, we don't need any help or care. Yet they may be struggling to live independently. There's huge risks involved. They may insist on cooking, uh, but they will leave the gas on, for example. So they need to be supervised or monitored in whatever they're doing. They may forget to bathe regularly, or they struggle to do that. So they need that sort of care and support. Most often, I think for majority of the people who we work with, accepting that they need help is challenging. And that's because just of the population that I've been working with and seeing are people who come to us for services, but they're essentially all people who were leading very independent lives previously. So that acceptance for the patient is difficult in a lot of cases. I think families, looking at it from the perspective of families, um, families understand that they need help, or that there is something that they need to do differently to care for the person with dementia. Sadly, a lot of times we see people saying, we take responsibility for caring for our parents, we know what's best and we will do it on our own. And then caregivers reach a point where they develop caregiver burden and stress, and it begins to impact their functioning and their mental well-being. So that's the kind of, when you're talking about help seeking and accepting help, that's the kind of challenges that we face, because a lot of people don't. There isn't really a medicine for it, so it's not about really refusing that. Medicines deal with the other aspects or challenges that physical health is relatively more acceptable to older adults. But there isn't anything specifically to reverse dementia. And so those are the kind of challenges that we usually see. But in terms of capacity to make again, decision-making capacity has already been impacted at the moderate to advanced stage. So it is usually the caregivers who we work with, and of course, we work with the family, the person with dementia, to help understand what they need. But there is usually a compromise in capacity there.
So, um, speaking of family and caregivers, right? Is there any way in which caregivers and just the society and community in which a person with dementia is living, is there anything we could do better or differently that could make people with dementia feel a little more accepted in society, a little more, normal, as best as it can get?
Absolutely. And I think that's a really, really important aspect you've asked about. The I mean, one of the things that I'm really advocating for is a more dementia inclusive society, because people want to live independently in their homes for as long as they're able to, and I think the society has a huge role to play in that. Whether it And I think, as individuals, we owe it to ourselves in the future, because we're all part of that demographic which is at risk for dementia as we age. It's that's something that I think people don't realize when we talk about dementia, that you're a part of that statistic, I'm a part of that statistic, everyone is a part of that statistic. And therefore, I think the first step is sensitizing people. If you see somebody, if someone has these signs and there are odd behaviors that they're seeing, one of the things it's really heartbreaking sometimes to hear how people living with dementia stop going out, meeting their friends because they feel embarrassed, they feel judged. And family members, like we hear spouses saying, oh, we can't go out with them anymore because they're so embarrassing, they keep on repeating the same thing over again, or they no longer know how to behave appropriately in a social situation, and it's really embarrassing for us. And I think we just need to accept that this is a condition, and that if this is that the behavior hasn't taken away from who that individual is, but what you're seeing or those changes that you're observing are actually a manifestation of a condition that they've developed. Everybody needs to be sensitized, right from the shopkeeper, because we've worked with cases where older adults, going to the shop was a routine, and they would do this repeatedly to buy something, but they could not manage their money. So you'd sensitize the shopkeeper to then, give the money back, or not fleece them, help them understand that this is just part of something that's important for this older adult, but how they're also playing a role in that intervention. To everybody, whether you're talking about other people in the society that you're living with, not accepting that this is just different behavior.
I think the notion of accepting people into society also has been transformed in the last few years because of capitalism. You know, if you are contributing to society in productive ways, it's easier for you to be accepted by society. And I think that's also where the stigma comes in about older people and very young kids not being extremely helpful to society. So that's it's extremely sad, and I feel like a lot of these factors contribute towards generating a lot of grief within the patients as well as the caregivers. And do you does Samvedna address grief as a specific thing to look at, or a specific symptom or an outcome of dementia to look at, and how, as a society, we could somehow, you know, um, show more empathy or develop more empathy towards these people, you know, not just somebody with dementia but also a caregiver, because I think caregivers also grieve throughout the process, right? Because they can visibly see they're visibly losing somebody they love. So do you think there is something we could do, or as psychologists, as researchers, to maybe increase the general levels of empathy in society towards old age and people who are suffering from old age related diseases?
Yeah, I think that's really important. I mean, at Samvedna, we look at all these things. We try to highlight all these issues through our awareness programs. They come up in the discussions. We help to sensitize people about what they should do differently. A large part of it is just acceptance, really, and I think the other part of it is being patient. You were talking about how capitalism and how that impacts the way in which we're evaluating the value of people on the basis of their productivity and contributions. Um, and it's a very ageist way of looking at you know older people in general, that they're beyond their expiry date kind of a thing. And it's I've seen interacted with youth who have some very not so great approaches to looking at older people. But I have to say that I think it's something that the Indian value system really is one that we should rely upon to develop. We have the underlying potential to develop a truly dementia inclusive society if we create awareness and address stigma. Because overall, by and large, we respect older adults. Uh, we can definitely do things to make society more comfortable for people with dementia and other older adults with various health related issues. Um, and I think that requires interventions at all, various systemic levels. But as individuals, I think if that's a change that we keep in mind, something we keep in mind, it will happen. And I think it starts a lot with being patient. So I hope that that's something which we'll kind of like dig into our intrinsic value systems, and then use that to support older adults and accept the fact that this is, yes, they may be irritating, they may be we may find it challenging to be around them sometimes, but still encourage and recognize the need that they have for remaining within society as members of society. They may no longer be productive members, but as just members of society who have their rights too.
Speaking of contribution towards society, I think contribution towards society need not be in very measurable ways. It can be in ways that are just helpful to individuals, right? And I was wondering if the inclusion of art, you mentioned this previously, that you use art in everyday life to help people cope with the symptoms and stuff. Do you think using creativity and art in dementia care and dementia inclusivity would normalize the coexistence of older people with like the youth? You think art could be a factor that brings them together?
I would love to see that. We've actually done intergenerational programs at Samvedna where we've had game sessions where we've encouraged children to come in with their grandparents and just be together. We actually actively, encourage families to do this. We encourage them to sit with different generations and do activities that they enjoy together. Art is a huge bridge in that direction. So from a family perspective, that's one thing that we encourage. Um, Even in our interventions, we incorporate various aspects of the arts. So, for example, be it coloring, painting, or something. It's not about creating something that is aesthetically certain beautiful or whatever. It's about encouraging the person who's living with dementia to be engaged in a process that is doing something to enhance their well-being. And so we use various types of we of art as part of our stimulation therapies. One of the things we also do, and this is absolutely amazing, is we ask the family to actually give us a list of songs that they enjoy, and we actually have had care specialists sing along with the older adults on a particular song that's their favorite, and it's amazing to just see how faces light up when you do these activities with them, and it's just amazing to see those smiles on their faces.
That's very sweet, and it's a brilliant idea, to be honest, to get grandchildren and grandparents together. I remember having grandparents' day at school where I would take my grandmother and my grandfather, and we would sing rhymes together and paint and color and things. And it's I think it's a great initiative, and thank you for doing something like this. It seems to be it contributes invaluably, in my opinion, to dementia care and just old age and caring for older people. So thank you so much for doing this. And before we conclude this extremely insightful conversation we've had, I would like to ask you: is there anything that you would like for our audience to take away from this conversation, from this episode about dementia, about geriatric mental health?
So thanks a lot, Tanvi. I mean, this has been really great. And I think in terms of takeaways, I think the first thing is it's important to just raise awareness. So if someone's listened into this and they learned a little bit about dementia, share it with somebody else. We need to create awareness about dementia. We need to create awareness about timely screening for dementia. There's so much more that you can do to enhance the quality of life of people living with dementia, as well as their families and other caregivers, if it's identified earlier on, because you have that window of time to prepare then for the future. So I think those are really important takeaways. The other thing is just about being more inclusive in society. Older, we've actually seen several, and again, I don't know, you said the younger lot and you referred to people in the 40s and 50s, and I think several we've done workshops with older adults, and we've had people who have taught enthusiastically about second careers in their 60s. So we were having this conversation around productivity. I think we tend to become quite ageist in terms of what can older people do. I've seen some amazing people. They're so inspiring in terms of they're just doing something that they've always wanted to do at a later stage in life. So I think we need to be very open and just encourage people to do whatever they can. And that's going to make our society not only supportive of older adults and aging, as we have an increase in the aging population, but also more sensitive to the fact that some older adults may have special abilities, for example, when they develop dementia, and that we need to be less stigmatizing and more accepting of these individuals. Similar to with neurodevelopmental disorders, I think there's been a huge shift in how people understand when a child has autism. There's, I think the society views this very differently now. And I think I would hope to see similar change when we see people with dementia being accepted as members of society as well, and that's something which we can all work towards.
I hope we move towards that reality very soon. And like you said, all of us are at risk population for something like dementia, and old age is inevitable. And I think the quicker we are at accepting the problems and the joys that come with old age, the easier it will be for people with old age related diseases to coexist in our society. And we're very grateful for Samvedna and for the work you guys are doing towards this goal. And we're very happy to have you on our podcast. Thank you so much, Jayashree, for taking out, I think, 2 hours of your time. I didn't realize how quickly time passed. The conversation was so interesting and so educative. Thanks again for being on our podcast and collaborating with ARISA. And we will see you folks in our next episode. Thank you.
Thanks a lot, Tanvi. It's been an absolute pleasure.